So in Chapter 3, we're going to look at both prenatal development, and then we will start to begin to look at the newborn baby as well. So let's go ahead and get started. Okay. So we'll begin with looking at prenatal development. It's really focused on 3 different phases. The zygote is really considered the first 2 weeks after conception. So if you can remember the number 2, it's going to help you differentiate these. The second stage is the embryonic stage, and that's from 2 weeks until about 2 months. And during the embryonic stage is really when very significant growth is happening. So all the vital organs emerge, and kind of key structural issues are also starting to take place within the baby. The last period of prenatal development is called the fetus, and that's from about 2 months until the time of birth. Now, you probably know that teratogens are very dangerous during prenatal development. I think most of you probably are aware of many things, like you're not supposed to smoke cigarettes or drink alcohol, but even over-the-counter medication can also be very dangerous. So if you're taking allergy medication, for instance, or even just Advil for a headache, things that wouldn't normally be considered problematic can certainly be problematic for the unborn child. There are also some other environmental hazards. Things such as cat litter are also problematic, so you may not always know all the things that you need to stay away from, and that's why it's really critical that you go and you reach out to your physician, and your doctor's really giving you good guidance here. Now, the most troublesome part of this whole process, I just want to go back a moment, is even if you stop using all of the over-the-counter medication, you don't change the cat litter anymore, at the moment that you find out you're pregnant, what happens is a lot of folks do not find out until it is during this embryonic stage right here. So during this period of time, we already talked about how important it is, in terms for development, because all the vital organs and structures are really happening. So although it's a good idea to stop as soon as you do find out, really the best way to prevent negative outcomes from happening the best that you can, at least factoring in what's within your control, is to really plan your pregnancy so that you're engaging in healthy behaviors right from the start, so that we have that kind of good foundation for our unborn children. All right, we'll go ahead and fast forward to when a baby is born. And when the baby is born, they will have their very first test. It's called the Apgar Test. And you can see here there's 5 different variables that they're assessing. And they're going to do this test both immediately after birth and then 5 minutes later. And for each variable, they can get either 0, 1, or a 2. Higher score is better. You want to have at least a score 7 or higher. The reason that they give this test twice is because sometimes babies just need a couple of minutes to adjust and adapt to the world, and then they're just fine. If we do not have a high score here, you're going to see some interventions happening pretty quickly to make sure that we're trying to address the baby's need depending on what the issue is. Now, if we look at the different types of childbirth, there are obviously different ways that babies are born. And the natural way would be without medication, using methods such as the Lamaze, where you're engaged in deep breathing and focusing and, just trying to concentrate, because as I'm sure you know, childbirth can be quite painful. So it is oftentimes difficult for folks to bear that pain, but the techniques can certainly help to some extent. There are others who are, interested in getting some medication, and sometimes that medication is warranted, especially if the, length of the pain or the nature and extent of the pain is causing too much stress on the mom and or baby. It might be better to administer some medications. So really throughout the entire pregnancy and even during the childbirth process, you want to constantly be in communication with your doctor so that you're making informed decisions about what's going to work best in this particular situation. Now, the cesarean method is obviously another method. Usually we're not going to use that approach unless it's warranted. There certainly are some folks who are trying to have babies on a certain day. They want a certain birthday. I mean, that is not the intent of the cesarean method at all. It really should only be used when the vaginal delivery is not, going to work for whatever reason, either size of the baby, position of the baby, other medical issues that might be at risk there. The time for the mom to heal afterwards is much longer for the cesarean than it is for the natural. So although the natural certainly is more painful during the process of childbirth, it is a much quicker recovery than the cesarean method. So we certainly want to avoid the cesarean unless it's necessary. So let's go ahead and take a look at the baby now. If we look at, there's just kind of this interesting issue. I don't know if you've ever been at a party where there's been a newborn baby and the baby's kind of passed around like the hot potato, I like to call it, and you know, it could be sleeping and you'll just hand it to a complete stranger and the baby doesn't even seem to wake up. So why do you think that that's really a result of? Well, what happens is that babies are in REM sleep, and you probably remember from Intro to Psych, REM sleep is that deep level of sleep, and they're in this level of sleep much longer than you know, older children and adults. So it's really for about 50% of their time that they're in this heavy-duty sleep. So chances are, if you fell asleep in class and we've kind of passed you around, you'd probably wake up pretty quickly because you're not going to be in that deep level of REM sleep. But for babies, they can. Once they hit around 2 or 3, that kind of is pretty much over, and everybody's kind of, shh, baby's sleeping, don't wake them up. So it kind of shifts a little bit and does change. A lot of folks ask about what are the sensory capacities of newborns. You know, I mean, can they, you know, do they have the same senses that the rest of us have? And the answer is yes, they certainly do. In fact, they've done a lot of very interesting research on these on this very issue. So you might be looking at this slide and saying something, well, how do you know that the baby prefers the mother's voice versus, you know, the voice of a stranger? Or how do you know they prefer native language? Well, it's kind of fascinating. To work with an infant researcher is quite a unique opportunity if you ever get that chance. They have to certainly be creative because we can't ask the baby, you know, which one do you like better? Point over here. They can't do any of those things. They certainly can't interpret language. They can't you know, respond with any verbal, you know, language yet, and they really can't point or do any of that gesturing as a newborn baby. So they look at things like eye gaze and attention and whether they are looking in that direction or for how long they're looking in that direction, or other facial expressions and things of that nature. And it's kind of neat because it's not surprising that the mother's voice would be preferred because that's what they heard the whole time during the prenatal period. Certainly we don't want to leave dad out or other key caretaker figures, but the truth is they're in the mother's body, so that's going to lead for the strongest preference at the very beginning, and then that certainly will shift as they have exposure to others as well. One other thing I want to point out is that the least the sense that is least developed is vision. So what happens here is that they're not really seeing that much, and that's part of the reason that you see some really bright contrasting colors, even the blacks and whites, and very bold kind of patterns, because their vision is not that well developed yet. But it actually does significantly shift in the coming months, so it will get up to where the adults are probably by about 6 months or so. Okay, so that hopefully gives you a little bit of the focus for Chapter 3. So I hope you enjoy the chapter, and I'll look forward to conversing with you on the message board.